Namaste, I'm Dr. Asif Ali, Consultant Emergency Medicine of Fortis Hospital, Nagarbhavi. With World Heart Day just a few days away, we want to create awareness about the most critical factors in saving lives during a heart attack, which is door-to-balloon time. When someone suffers a heart attack, especially the type called ST elevation myocardial infarction, every second matters. The faster we can restore blood flow to the heart, the more heart muscle we can save and the better the chances of survival. Door-to-balloon time is the time interval between a patient's arrival at the hospital door to the time we open up the blocked artery. International guidelines recommend to keep this time under 90 minutes. At Fortis Hospital, we consistently strive to keep our door-to-balloon time within these benchmarks. This is possible because of our 24/7 emergency cardiac team, advanced cath lab technology, and well-researched STEMI protocol. From triage nurses to interventional cardiologists, everyone is trained to move in perfect coordination because in a heart attack, minutes mean muscle. Our mission is not only to save lives when a crisis strikes, but also to help you prevent a crisis. That's why we urge you to schedule regular heart checkups and assessments. These simple steps can help us detect heart problems early. As we approach World Heart Day, remember, early action saves heart muscle and lives. Fortis Hospital Nagarbhavi is committed to deliver fastest and most efficient cardiac emergency care and supporting your heart health every day of the year. Thank you.